Wondering what a healthy pregnancy looks like, month by month? Today, we'll cover normal signs you can expect, simple nutrition and movement tips, common appointments, and when to call your care team. This is educational, not medical advice. Every pregnancy is unique. If you notice severe pain, heavy bleeding, vision changes, or decreased baby movements, contact your clinician immediately. Month 1, weeks 1 to 4, the invisible beginning. Healthy signs you may notice: missed period, mild cramping or twinges, light spotting, breast tenderness, fatigue, increased urination. The home test often turns positive around the time of your missed period. Appointments and to-dos. Book your first prenatal visit, usually around 8 to 10 weeks. Begin or continue a prenatal vitamin with folate, iron, iodine, and vitamin D. Hydration goal: aim for 2 to 3 liters per day. Nourish and move. Try small, frequent meals if you're feeling queasy. Gentle mobility work and short walks are beneficial if you feel up to it. Call your clinician if you experience heavy bleeding, severe pain, fainting, fever, or persistent vomiting. Month 2, weeks 5 to 8, hormones in high gear. Healthy signs: nausea with or without vomiting, heightened smell, food aversions, mood shifts, bloating and constipation. Fatigue often ramps up during month 2. That's totally normal. Appointments and checks. The first prenatal visit may include history, labs, and a dating ultrasound. Discuss medications, nausea strategies, and food safety at your visit. Nourish and move. Keep protein and complex carbs on hand. Yogurt, eggs, smoothies with spinach and chia. Ginger tea, B6 per provider, and plain crackers on waking can help nausea. If you can't keep fluids down for over 24 hours, contact your clinician. Month 3, weeks 9 to 12. Foundation set as symptoms begin to shift. Healthy signs: nausea may peak then ease toward 12 weeks. Waistband feels snug. Emotions fluctuate. Mild headaches possible. Appointments and checks. Genetic screening options may be offered. Discuss timing and choices with your provider. Routine blood pressure, weight, and urine checks typically begin around this time. Nourish and move. Aim for protein at each meal: eggs, beans, fish, tofu, plus fiber-rich foods. Keep low-impact movement like walking, prenatal yoga, and light strength if cleared. Green flags. You're finding a meal rhythm, hydration is steady, and fatigue is manageable with rest. Month 4, weeks 13 to 16, the energy return. Healthy signs: energy improves, nausea decreases, a tiny bump may show. Some feel flutters later in this month. Appointments and checks. Ongoing vitals. Discuss second trimester screening. Consider a walking routine you can maintain most days. Nourish and move. Emphasize iron, lean meats, beans, lentils, plus vitamin C, citrus, peppers for absorption. Add choline, eggs, and DHA, salmon, sardines, or algae-based supplement if not eating fish. Green flags. More stable appetite and easier hydration. Mild round ligament twinges can be normal. Month 5, weeks 17 to 20, baby on the move. Healthy signs. Regular movements, quickening, begin for many. Skin hair changes, some nasal stuffiness. Appointments and checks. Anatomy ultrasound around 18-22 weeks. Discuss posture and sleep positions. The left side is often more comfortable. Nourish and move. Calcium plus vitamin D for baby's bones. Dairy or fortified alt, greens, sunlight, Vit D per provider. Prenatal strength, squats, rows, presses. Light moderate intensity if cleared. Green flags. Movements become recognizable. Energy stays relatively stable. Month 6, weeks 21 to 24, growth spurt. Stronger kicks, appetite increases, and possible heartburn, hard leg cramps. Appointments and checks. Screening for gestational diabetes is typically scheduled soon, 24-28 weeks. Discuss support belt for back-hip discomfort. Nourish and move. Smaller, more frequent meals for heartburn. Magnesium-rich foods, pumpkin seeds, beans, greens, may help with cramps. Continue walking, mobility, and pelvic floor awareness. Green flags. Consistent growth measurements, movements feel regular. Month 7, weeks 25 to 28, strength and stamina. Healthy signs. More defined movement patterns. Occasional Braxton Hicks, mild, irregular tightenings. Shortness of breath with exertion can be normal. Appointments and checks. Glucose test if not done, ROGAM if indicated, Tdap vaccine typically offered. Monitor blood pressure and swelling regularly. Nourish and move. Protein at every meal. Aim for 75 to 100 grams per day. Personalize with your provider. Post-meal walks, about 10 to 15 minutes, help with glucose control. Gentle strength and stretching are good too. Call your clinician if you have a persistent severe headache, visual changes, sudden swelling, or upper abdominal pain. Month 8, weeks 29 to 32, final prep. Healthy signs. Baby's movements are strong and daily. Sleep may be more fragmented. You may have more frequent bathroom trips. Appointments and checks. Growth checks, position monitoring, and discuss birth preferences. Consider choosing a pediatrician and planning an infant-safe sleep setup. Nourish and move. Prioritize fiber and fluids to help prevent constipation. Try left side rest, pillow support, and hip-knee alignment for sleep comfort. Green flags. Look for daily, predictable movement windows, commonly after meals and in the evenings. Month 9, weeks 33 to 40 plus, the home stretch. Healthy signs. Some women notice the baby drops or lightening. Braxton Hicks may feel stronger, and pelvic pressure can increase. The cervix may begin to change late in pregnancy. It's only checked if needed. Appointments and checks. Weekly visits are common after 36 to 37 weeks. Group B strep screening is typically around 36 to 37 weeks. Discuss when to go to your hospital or birth center. For example, water breaking, regular contractions, bleeding, or decreased movements. Nourish and move. Keep easy-to-digest meals, frequent snacks, and solid hydration. Gentle walks, birth position practice, and breath work can help with focus and comfort. Call your clinician immediately if decreased baby movements, heavy bleeding, leaking fluid, fever, severe headache or vision changes, chest pain, or sudden swelling. Avoid alcohol, keep caffeine, 200 ml a day. Choose low-mercury fish, salmon, sardines, trout. Avoid high-mercury species. Skip unpasteurized dairy juices, raw sprouts, and undercooked meats, eggs. Reheat deli meats until steaming. Wash produce well. Prenatal vitamin daily. Protein at each meal. Colorful vegetables plus fiber. Hydration. Steady sips all day. Move most days. Walks. Gentle strength, mobility. Sleep routine. Cool, dark room. Track baby movements in the 3rd trimester. Keep all prenatal appointments. Healthy pregnancy signs change month by month. Energy rises and falls, appetite shifts, and the baby's movements evolve. Use this guide to know what's typical. Nourish your body consistently and stay in close contact with your care team. If this helped, tap like, subscribe, and comment glowing with how many weeks you are today. You've got this.